Can I just check with Ben that we are, or we are indeed quorate, or as far as we can be. We have received apologies from Ian Dodds, place member for Richmond, John Byrne, our Executive Medical Director, and Jonathan Bates, our Chief Operating Officer. The board will be aware that our Chief Nursing Officer starts next week, and with her not yet in attendance and John Byrne, our Medical Director, we will need to suspend standing orders because we need one of those to be in attendance, and I propose that we use Section 5 of the Constitution to suspend those standing orders so that we can be officially quorate. Are people content with that? Thank you very much. If we can note the register, the declarations of interest on the register of interest, which are included within the pack, and I'm assuming that nobody has any additional declarations they need to make today. So we move on to the minutes of the last meeting, and that meeting was on the 17th of May. Can I ask colleagues whether they are content to approve those minutes? I see nods indicating assent. There are 3 open actions on the action log, none of which are due for completion yet. So I'm assuming there are no further updates in relation to those. If I can move on to matters arising now. Prior to this meeting, we had a Part 2 meeting which considered 2 substantive items. The first of those was the annual report and the accounts for NHS South West London Clinical Commission Group, which covers the period from 1st of April to the 30th of June. The second item was the final draft of the annual reports and accounts for South West London Integrated Care Board. They covered the 9-month period from 1st of July to 31st of March. They also included the People and Communities annual report, which will be used as part of NHS England's assessment of our local engagement work. I wish to report in public that the board approved those documents and the letters of representation for both CCG and the ICB, subject to any final amendments which will be approved by the audit chair, unless they are material. The final versions of the annual report and the accounts will be made available, published on the ICB website in line with NHS England guidance later in the year. Move on to the substantive item of this agenda, which is to receive the joint forward plan. And I'm going to pass across to Karen now, Karen Broughton, who has led this piece of work, to talk us through the documents, and then we'll decide whether or not to approve them. So Karen, over to you.
Thank you, Chair. Good morning, everybody. In 3 days' time, South West London Integrated Care Board will have been established for a year, and so it's important at this point that we review the strategic context in which we operate, that we think about and set out our ambitions for the future, and therefore the direction for the NHS in South West London. And as you will all be aware, we've therefore been developing our joint forward plan, which will set out that plan for the next 5 years, so that we can be really clear how we work together to meet the needs of local people. The joint forward plan has been developed through a process of engagement and collaboration. I'll come back to that in just a second, with both people and communities and our colleagues from across South West London. And what the plan makes very clear is that in order to achieve the ambitions, things will need to happen over a period of time. Some of the changes that we're describing can't happen in a single year. And B, that we're going to need to work together differently in order to shift our focus from treatment to prevention, to make sure that we support people to make healthy choices and improve the services and the way that we provide care to the people of South West London. We've written the plan in 2 phases, and in March, board members and members of the public and our stakeholders received the first phase of that. And what that tried to do was to outline the strategic context in which the NHS in South West London is operating in, the experiences, the views and concerns of people and communities, and also the ambitions that we were looking to set and create for the NHS in South West London. Phase 2, which you now have the full document in front of you, focused on developing our actions to deliver each of those ambitions, how we'll measure that progress over the next 5 years, but also took into account, obviously, the feedback that we received in stage 1. And just a word about the engagement. So we wanted to make sure that the Joint Forward Plan was a collaborative plan. And so we have engaged quite extensively in its development. The first phase, when we began to look at what we were going to do and how we were going to do it, we were very grateful for the advice of Healthwatch and the voluntary sector on the ways to approach engagement. The communications and engagements team analysed over 180 engagement reports. We were clear we didn't want to keep asking members of the public for their views on things they had already told us. We built the document based on the views of people and communities, and each of the chapters you'll see has a summary of the feedback that people have given us. We published our Joint Forward Plan, the first phase, in March, and we sent that around to a number of stakeholders, and as I said, all those people before. We also sent it to the chairs of the Health and Wellbeing Boards, and I'll come back to the important role that they place in this as well. We received a number of responses. We had 599 responses to an online survey. We led 7 focus groups, 187 one-to-one conversations, outreach events, etc. And we are now at the point where we can recommend to you a plan for the next 5 years. And that plan identifies an overarching ambition, and that is that people in South West London start well, live well and age well, and that together we make real and tangible improvements for the health and care of local people. And really important to say that that ambition mirrors the Integrated Care Partnership's ambition to make sure that both the ICB and the ICP are working very closely together. And to make sure that the action that we wanted to take was absolutely addressing the areas of need. There is a chapter in the document around the health needs of the local people in South West London. The plan also sets out a focus, and there are 8 areas of focus, and that is that we work together to prevent ill health and support people to self-care, that collectively we work to reduce health inequalities, that we keep people well and out of hospital, that we provide the very best care wherever patients are accessing our services, that we use technology where it's right to do so to improve care, that we manage our money well, that we make South West London a great place to work, and that we deliver the requirements that will be set for us from the ICP strategy in relation to the developments across the whole of the system. Just a word about the document itself. Each chapter has been written as a standalone chapter, so you will see every time you read a chapter, the context is clear, the summary of what people and communities tell us is there, the ambitions for that particular area are there, and then our focus and actions over the next 5 years are there. You'll also see from the document that we have the health and care plan summaries of each of the places in South West London, and we also begin to look at how we'll measure both the impact of what we do and the outcomes that we will have. But board members will know, and the Joint Forward Plan outlines, that we have a financial challenge over the coming years. There is an indicative 2-year delivery plan in Appendix 3, but I suppose we will need to make sure that we keep that under review as we continue to deliver and work forward with our financial pressures. We've also tried to put inside the document some case studies, some spotlights, so that actually what people can see is the work that is already happening within South West London to improve health and care across all the areas that are contained in the document. 2 important alignments just to mention to board members. The first is the alignment with local health and wellbeing strategies. And as part of the national requirement for the Joint Forward Plan, the ICB and our partner trusts must consult with health and wellbeing boards on our plans to make sure that they properly take account of the local health and wellbeing strategies that have been published by each of our health and wellbeing boards. Health and wellbeing boards are asked to respond with their opinion on that, and we will, as we get those through, publish those as part of the plan. But I just wanted to give you 2 examples, or two statements that we've already had. One is Croydon, and Councillor Yvette Hopley has, on behalf of the Health and Wellbeing Board, thanked us for involvement in the Health and Wellbeing Board and the development of the NHS Joint Forward Plan. Croydon's Health and Wellbeing Board received that paper and are developing the Integrated Care Partnership in March. And submitted their health and wellbeing priorities to make sure that they linked and that the themes that they were wanting in there were there. The plan that has been produced by South West London is a really good high-level document. The strategic priorities are well aligned, but of course, drilling down to the specifics at place will be the key to successful delivery. And we know that even within each borough, there can be significant differences, and working together on things like gap analysis will help us to address some of the inequalities that exist. She goes on to say that the Health and Wellbeing Board are currently reviewing the strategy for Croydon, and will refresh that and let us know that when they finish that, obviously, to make sure that collectively we're delivering for the people of Croydon. Councillor Piers Allen from Richmond has also provided a statement, and he says that the Health and Wellbeing Board were pleased to formally be consulted on the Joint Forward Plan in March, and having been involved in its development, they're pleased to confirm that their opinion is that the Joint Forward Plan does represent a shared delivery plan for the integrated care strategy of both South West London and Richmond upon Thames, and that it takes into account their local health and wellbeing strategy. And then the fact that the board welcomes the very close partnership working with the ICS, so the IC Integrated Care Partnership Board, and the partnership itself. And they look forward to working with us both more closely as we go forward. We'll obviously make sure that those are reflected in the final part. And then just finally, because I want to make sure that we've got some time for conversation, I wanted on behalf of the board to thank all of the contributors to the 5-year plan. Writing a system strategy is complex and difficult, and it certainly takes and was a team effort. And I think I also want to acknowledge that it was developed at a time when the NHS was under real pressure and was very stretched. Want to also thank on behalf of the board the people and communities across South West London who engaged with us and who gave their views and their insights, and also to Healthwatch and the voluntary sector that helped us navigate the way of best engagement on the document. And then finally to the strategy and communication engagement teams who were critical in bringing all those important elements together into what I think is a clear, coherent and ambitious plan for the NHS in South West London over the next 5 years. And then, Chair, I would like to recommend, therefore, that the board agree the South West London Joint Forward Plan that will take us from 2023 to 2028 with an annual review each year, which won't be quite as detailed as the plan that you have in front of you today. Thank you.
Karen, thank you for that. And I know it's been an enormous amount of work for you and the team in terms of pulling this together, undertaking the engagement and ensuring that we also aligned with the operating requirements and the NHS mandate. So it has been a complex process and one which I think when we look at the documents, we can see the scale of the ambition and both the challenge and the ambition that we have in terms of improving health and care and ensuring NHS resources are spent wisely across South West London. If I could first of all go to the co-chair of the Integrated Care Partnership, we are, as an ICB, required to ensure that we take good account of the work of the Integrated Care Partnership, and that's reflected in our priorities. Ruth, could I ask for your comments in relation to the forward plan?
Thanks, Mike. And I agree, it is a very extensive, thorough and fascinating piece of work. And I do like the way that we've integrated the comments that we've received from our many residents into that document. I think it brings it alive and makes it a lot more meaningful. So it's a huge amount of work that's gone into it. I would very much endorse the views that have come back from Croydon and Richmond. And I know that Sutton is also, we've almost finalised our views. So you'll get it back today, Karen, for sure.
Thank you, Ruth.
But it does feel that this is being done together in collaboration, and that's important. I think my main concern, and I'm sure that's shared by everyone, is that if you look at Appendix 3, as Karen rightly highlighted, there's a huge amount of work to be done there, and it's not clear who's going to do what. And my worry is that in trying to do everything, we don't actually work out exactly what our priorities are and who is going to achieve what needs to be done. I think it's really important that there's an extra piece of work on top of this so that people have ownership and understand exactly what's going to happen by when, what is achievable, and have some sense of what success looks like. But I do think it's a really important piece of work, and congratulations for getting it done in what I would say is record time. Thank you.
Thank you for those comments, Ruth. And if I go to Mike Jackson now, our local authority Chief Executive Lead.
Thanks, Mike. I just really endorse Ruth's comments. I don't think I've got anything of substance to add to that. Fully endorse Ruth's comments. Thanks, Mike.
Very keen to hear from our voluntary sector and market watch colleagues. So if I could first of all go to Sarah.
Oh, yes. Hi, thank you very much. I think it's a great report. I really like it. It's clear, it's very detailed. I love the case studies and the way you bring in, you know, the input from the voluntary sector as well as residents. For me, I think, and I've spoken to Charlotte about it and her team, is about how are we going to inform the voluntary sector of all the areas of focus, and maybe taking individual chapters and kind of really, you know, separate them and really think about what channels of communication we can use to reach the sector, and also in a simple way explain what role they can have. You know, what is their role, how can they support, you know, how can they engage, and then also later on, how can we show the progress to the sector. So again, thinking about comms, how can we show the progress and where the role is, that would be really beneficial. We have been invited to hopefully present one of the next meetings, and one of the things that I want to ask everyone is, so what are the conversations we can have where we can make a difference together? And that is probably going back to what Ruth was saying about the plan being quite wide and quite big, and thinking about maybe one area of focus where we can make a difference with the voluntary sector and everyone's support.
Sarah, thank you for that. Elisa, did you want to make any comments at all?
Yeah, I mean, I agree with many of the comments I've heard so far. I think my main concern is just making sure that this plan is maybe not saying redeveloped, but maybe a summary, a summarized version could be provided to members of the public, especially one that links the concerns that we heard from them directly to the 2-year delivery items presented in Annex 3. I think this would help people feel like, you know, their voice really counted, and that their participation in the development of this plan was worthwhile. Be very happy to help advise on the creation of such a summary version. One of my, and maybe this is a bit too nitty-gritty, but one of my concerns just about the action items, there is reference to ensuring that we address digital exclusion and reduce it, that's the word, not eliminate, by 2028. And I wonder if we can be a bit more ambitious about that and set a shorter timeline to working towards a more digitally inclusive NHS. So just wanted to reference that. Thank you.
Thank you. And all of those comments will be taken on board by the executive team. It's probably worth saying that in addition to this document, the board is going to be presented with a series of strategy papers relating to specific items. We've already received the mental health strategy, which we've approved. We've seen drafts of primary care and all the other strategies moving forward. Just a reminder, you know, our job is, we've got 4 key statutory duties as an ICB: to improve outcomes in population health and healthcare, tackle inequalities in outcomes, experience and access, enhance productivity and value for money, and help the NHS support social and economic development. And against all 4 of those statutory objectives, I think we set ourselves some ambitious and stretching targets. Happy to take any other final comments before we move to approving the documents. Sarah.
Yeah, can I just add my thanks to everyone involved, but particularly to Karen and Charlotte, who've done a huge amount of work. Can I say personally, as you know, well as their teams, I just want to personally thank them for all the work that's gone into it. But I would also say this is a starting point, really, isn't it? It's a 5-year plan, which we're going to refresh annually, and of which we're going to have a kind of implementation plans, and as Mike says, various strategies attached to it. So I think that for us, what I don't want this to be is a document that then goes on the shelf and we never look at again. This is going to be our guiding kind of star, really, for everything that we need to do over the next 5 years. And what we need to do is keep coming back to this. And I think the fact that we're refreshing on an annual basis, we're not refreshing, but we'll be doing a kind of a refreshed annual plan, is actually a good thing, because what that will do is remind us of what we have committed to here, and then enables us to actually to amend and update and to consider where we've got to on an annual basis. So I think that's a very positive thing, actually. I know it kind of sounds a bit daunting to say we're going to sort of review it every year, but I think that's much more of a, have we actually delivered what we said we would deliver? What do we need to amend? How do we take this forward? So, you know, I would just endorse it as a sort of starting point for the next 5 years, and recognise that there's still considerable work to do to actually implement and to make sure we're reviewing annually.
Thank you for that, Sarah. Karen, any final comments you want to leave the board with before we go to decision?
No, I thank you very much for the comments that you've made. We will certainly take those on board, particularly around the kind of the comms and the engagement that we continue to want to have in the development of the plan. But as Sarah said, I suppose this is the starter. We will be now looking at this as an annual basis on the as a board. So so we will be talking about it more frequently, Mike. But yeah, no, nothing more to add other than that.
Fantastic. Thank you very, very much. Can I ask colleagues if they're content to approve the joint forward plan for 2023 to 2028? And I'm seeing lots and lots of nods and positive thumbs up. And I'm sure that the thanks that have been made to Karen and Charlotte and to their teams is shared by everybody on the board. So on that basis, we approve the document. I've not been alerted to any other business for this meeting. And we would normally now go to questions from the public. We did invite them to submit any questions by email. We haven't received any, and therefore I'm happy to close the meeting. See you all at Clarendon Hall in Twickenham on the 19th of July. Thank you.
Thanks, everyone.